recommended treatment, some of the things you mentioned, but is there something that people can take or use that would help them like go through that healing process faster? Because, you know, like you said, it takes a lot of work. And also, how does LUMNA specifically help with that?
Absolutely. So, right now, in terms of somatic pain, there's really no on-label, like FDA-approved therapy for that. Body work, massage and other body work or trauma-releasing exercises, or somatic experiencing, which is a kind of type of therapy. Certain PTSD work might help. But really, it's all kind of Wild West in terms of therapeutics. There's nothing like on label for this because it's really an emerging field. So the idea is to move the issues out of the tissues. And again, you can do that manually or through your own exercises. But what LUMNA does is helps to move the emotions out of those problem areas. And again, this goes back to how the formulation was designed to be both regenerative and restorative, but also to kind of detox those nerves. So it helps to, and even just the act of self-massage is an act of self-care that will increase parasympathetic output and increase vagal tone to go into a more restorative place. And definitely all of the constituents in there are intended to balance stress hormones and to reduce stress hormones and to improve parasympathetic tone and improve the mood also. And again, a lot of these constituents are intended to sort of rewrite these pain pathways and the brain processing of the pain. So it really is adjusting the entire nervous system from the top down, brain, spine, out to the periphery, and then also back. So there's this sort of circuitry. So physically, yes, kind of moving the stored emotions out manually, but also helping with that nervous system component. And still, I think the way that I view it as being maximally effective is using the product and then doing, once the nervous system is a little bit more chilled out and the pain's a little bit better, then doing some of this trauma-informed work, doing trauma releasing exercises or getting massage with the product, things like that, so that you are moving the energy and the actual emotions out, but you have this catalyst to make it a little bit easier. And to also dampen because it can be very emotional when, if somebody's ever had any sort of somatic release, it can be really intense and emotional. And so having something to kind of support the entire system to feel safe in that is also critically important. And even our, the product that we intended for pain, it definitely still balances the mood and helps people with anxiety and helps people with, low mood. And so it's, even though, yes, it's designed for pain, it's not in a vacuum. Like, we're very focused on the mind-body connection through the nervous system.